potentially harmful effect of the risk principle, which is that intensive treatment for low-risk offenders often increase failure rates. There are two reasons we think this occurs. One is that low-risk offenders learn antisocial behavior from higher risk. That's a pretty obvious one. We don't think about it much, but you'd never put your teenage son or daughter in with a group of high-risk, drug users and gang users, would you? Right? I mean, we wouldn't do that. And second is because when we take low-risk people and put them in intensive kind of interventions, we often disrupt what makes them low risk. And so, it's interesting when I was watching the judge talk about the flash incarceration and some of the other things that are going on. I think you have to be careful there as to who it's being applied to. For example, if I were the department and I started to look at risk and need and develop kind of guidelines around, policies for revocations or for technical violations, if someone's low risk and they have some difficulties, I'd have a number of options there for them that may not include incarceration. High risk, absolutely, that should be on the list. But for lower risk, and again, here's what I mean. If you're all low risk, everybody here is low risk. If I took you right now and locked you up in a good correctional treatment program for 6 months, 3 months, how many of you lose your jobs? How many of your families would have difficulty getting by without you? Right? How many of your neighbors would have welcome home from the correctional treatment section for you? In other words, I would not reduce your risk. I'd give you some new risk factors. All right? So that's why we think that these effects occur. We've seen it in numerous studies. This is one looking at intensive rehabilitation supervision, happened to be done in Canada. And you can see that for this particular program, it's kind of like our intensive supervision, except the Canadians do treatment. We kind of do see them and pee them kind of approach. You can see here, high-risk offenders that went into the treatment program had a 31% recidivism rate. So that was the recidivism rate after 2 years. High risk that did not go into the treatment program had a 51% recidivism. That's a significant reduction in recidivism. Okay? But look at what happened to low risk. They failed at double the rates that low-risk offenders did that were not put into the program. Now, I know what you're thinking. Right? That's Canada, and there's only like 6 offenders in the whole country. I did this study in 2002. At the time, it was the largest study of community-based correctional treatment facilities. We're a big halfway house state in Ohio. We have lots of halfway house beds, lots of contracts for halfway houses. You're not a big halfway house state. And we also have what we call community-based correctional facilities. We built, at the time, we had 15 of these facilities. These facilities are for probationers. So these are for felon probationers. These are folks that are directly sentenced to these facilities by judges. They're there for 4 to 6 months. They get lots of treatment. And the halfway houses were reentry programs. They were for people coming out of prison. So this study had everybody in it, probationers as well as parolees. Basically, the state wanted to know how effective are all these programs. They're spending all this money. How effective are they in reducing recidivism? So we gave everybody a risk score, and I knew I didn't want to compare low risk to high risk. I wanted to compare low risk to low risk, high risk to high risk. So what you're seeing here, this is the treatment effects. Remember what a treatment effect is. For low risk offenders that were placed in these programs, it's irrelevant what the programs are to you, but you can see these red bars is an increase in recidivism. So 3 out of 4 programs in the state increased recidivism rates when low-risk offenders were placed in those programs. We had some few programs that got just small effects on low risk. This is the treatment effect, the same programs for high-risk offenders. Now it's flipped. So what you see here is that most of the programs reduced recidivism for the higher risk offenders that were in their programs. We had, and here's really where you see the risk principle. I'll show you. Just pick this one. Mahoney County. 32% reduction for high-risk offenders, 29% increase for low-risk offenders. So the same program was having a very strong effect for high risk, was being negated by the effect for low risk. Now, I should point out, we had 8 programs did not reduce recidivism for anyone at any risk level. We had other risk level, moderate and low moderate and so on. These programs didn't work for anyone. Anyone know what the scientific term for that is? Shitty program.